you, oh, really?
Yeah.
That's cool. How awesome do you?
Well, I'm the facilitator.
Oh,
That's your job.
Oh,
Jeez, let her do her job.
Well, I thought you were just being nice.
But it's my pleasure. It's my pleasure. I'm Charlene Latardo. I am a nurse at Bios Fertility, and I'm the Director of Clinical Operations. So we are at a tough nut to crack, straightforward nutritional tools to consider for you and your patients. Our presenters today are Dr. Michele Nichols and Mara Mucato. You got her name today. Dr. Michele Nichols attended naturopathic medical school at Southwest College of Naturopathic Medicine in Tempe, Arizona, followed by a residency specializing in naturopathic family practice. Dr. Nichols is trained as a primary care physician specializing in naturopathic medicine and acupuncture. Dr. Nichols established the first naturopathic medical residency program in Wisconsin and functioned as a residency director, mentoring naturopathic residents and medical doctors. She has worked in corporate wellness and private practice for over 16 years. Dr. Nichols offers naturopathic medicine treatment for people of all ages and conditions. She uses effective non-toxic treatments from conventional and alternative medicine. Her education, training, and clinical expertise allow her to help patients stimulate the body's own healing mechanisms and transition into a healthier lifestyle.
That makes me sound really good.
No,
I mean, really good.
I'm now
Yeah.
very impressed. And I told her it doesn't come easy, like it happens all the time. So, but now I actually am legit
Well,
impressed,
and I'm
intimidated
yours.
too. I'm very intimidated.
And Mara is involved in the provision of art services in Canada since working as an embryologist at the Toronto Center for Advanced Reproductive Technology from 89 to 97.
I just got it.
Individually tables 25 years plus experience in reproductive health, patient education, and product placement. Mara delivers a wealth of business expertise, commitment, and dedication to her clientele. Welcome,
That's pretty
ladies.
good too. Yeah.
So, take it away.
So it's a round table, but it's technically a square table.
It is technically,
Rectangle,
yeah.
right?
It looks like a
Right.
rectangle. It does look like a rectangle.
And so I wanted to provide you with the slides. Unfortunately, you can see the font is a little small, so bear with us, I guess, with that. And so when Mara and I were kind of thinking about what we're going to talk about, nutrition has so many different variables and ideations, and so I kind of wanted to look at things that I see in clinical practice that are kind of new and up and coming. And essentially it's looking at how genetics, nutrigenomics play a huge role in essentially fertility management, and also pregnancy and pregnancy outcomes. So if you look at my picture there, a tough nut to crack, I mean, it's pretty good. I mean, that's what I was trying to, like the,
Yes,
the
I get it.
egg with the nut, the
sperm,
crack.
the
Yeah,
like,
what do you,
yeah,
you think
I
it's pretty
like-
good?
I actually think it's excellent.
Thank you,
Very,
thank
very
you.
good. No, it's hot. It's a tough egg to crack.
Right. So nut, egg, yeah.
Yeah, I get you.
Cool. All right. Well, so our objectives, and this is going to be very casual. So definitely chime in. But I want to talk about genetic medicine and nutrigenomics. Okay, genetic markers in the infertile patient, and then what you're going to do with that information. Okay. When you look at rates of infertility, it's on the rise, and I think that's why a lot of these conferences exist. Why a lot of these clinics exist. But why is that? Why is it on the rise? Okay? Between 16 and 25% of all couples have problems conceiving. I mean, to me, that's pretty significant. So, as a naturopathic physician, my job is to really look at what factors are influencing that, and then how do I optimize that so, pregnancy is good and birth outcomes are sufficient. So some of the things that I might look at would be balancing out hormones, right? We all know that that plays a huge role. supporting egg and sperm quality, optimizing fetal development and brain health, and then looking at preventative, potential risk factors like potential for high blood pressure, folate deficiencies, gestational diabetes, and looking at this through genetic testing. So when you look at the growing technologies available out there, there are a lot of different companies that do genetic testing. And this is looking at potential risk factors. Now, the genetic testing that I'm talking about is not chromosomal. So it's not looking at cystic fibrosis, it's not looking at Down syndrome, it's looking at the specific genetic genes on the chromosome, okay? So you can have normal chromosomal, development, but you can still have a genetic abnormality that can increase risk of a specific disease. And then that's when you look at nutrition and make things really specific for that patient, okay? And this is really nutrigenomics. So what is nutrigenomics? Well, it's looking at how nutrients impact gene expression. So we can have that hereditary predisposition, but genes can be turned on or off by environment, right? That's phenotype. And that's really looking at how, again, environmental influences, whether it's nutrition, stress environment, the air we breathe, how that all affects that potential gene expression. So there's a lot of genes that are critical for determining function, nutrient absorption and utilization, as well as looking at potential genetic background issues. So what are we looking at from a genetic variation standpoint? Well, we're looking at these single nucleotide polymorphisms, which are called SNPs. You guys heard of SNPs? Okay, so that's really what we're looking at. And so the SNPs that we're going to go through today are going to be the ones that are going to be specific in reproductive health. So when we look at genetic variation or SNP, and we have poor nutrition, and we have environmental factors, it's like the trifecta of what can impact infertility, fetal growth, and birth outcomes. Again, this is not the genetics of, Down syndrome, cystic fibrosis, okay? This is looking at potential and more of environmental influences on that gene. We know that almost 50% of infertility issues are due to genetic defects. Isn't that nuts?
It is nuts, and I think, what I'm of the group of people that came up through the 80s and 90s in terms of provision of care at a clinical level. And there was this group of people that they weren't male factor and they weren't female factor, they were unexplained. And I actually think that nutrigenomics is the explanation.
Yes.
And sometimes if we can identify how their genome is impacting their day-to-day life or life quality, and those things that they do, we can make a quick, easy fix.
Yep.
It baffles me that people don't understand that what you eat is what you are. Because we're machines.
We are.
And we go to a clinic and we're willing to spend $20,000, $40,000, $80,000 to make a baby. You won't buy a vitamin. Or you won't sell the vitamins. Right? You have trouble. I don't know how to sell the patient vitamins, and it could be the best decision you make for them. Because they may not even need that yet.
Sure. Yes, 100%. And I think too, because I do see a lot of infertility in my practice, to have unexplained infertility or idiopathic infertility. Now, I don't want to be called an idiot, right?
Yeah.
And how is it not explained? And I see it's so, wearing on the body and taxing and